Good morning, good afternoon, good evening, everyone. I hope you managed to catch the preceding session on building resilient and sustainable social enterprises. Welcome again to AVPN's first South Asia Impact Capital Festival. I'm Kevin Teo, COO at AVPN, and your MC for this session. Thank you for joining us today. AVPN's mission is to move more capital towards impact in Asia by activating our network of 600 plus members and providing opportunities to connect with key stakeholders across various sectors and markets to learn from one another and to find opportunities for action. We will be sharing highlights of our day live on Twitter, so don't forget to share your experience with us by using the hashtags AVPN South Asia 2021, hashtag Impact Capital, and hashtag Social Impact. Throughout the month of February, the festival will spotlight best practices and solutions that AVPN members are delivering across India, Bangladesh, Nepal, and Sri Lanka. Last week, we focused on healthcare, and you can access all session recordings through the agenda link. Our focus moves to livelihoods for this week, and we will continue to climate action and education for the next 2 weeks. Please note that this session will be recorded, and you will be able to access the recordings for 3 weeks after the festival. We encourage you to chat with your speakers and fellow delegates in this session, and you can do this through the chat tab located next to the streaming window. Please also share any questions you might have for the speakers through the Q&A tab. This session will discuss how to rebuild a dynamic and durable blueprint for India's social protection architecture. The moderator for the session is Vivek Bhandari, visiting professor of history at Kriya University and chairman of Geo Payments Bank. After a decade as a faculty member at Hampshire College, where he also taught at the University of Massachusetts Amherst and Mount Holyoke College, Vivek served as director and professor of social science at the Institute of Rural Management, Anand. For the past decade, Vivek has served as chair of IFMR's Internal Review Board. Vivek, the floor is yours.
Thank you very much, Theo, for that very kind introduction. Good evening, everyone. First off, many thanks to AVPN for organizing this marvelous event and so many wonderful sessions. And more specifically, this particular session. Our topic today, which is about rebuilding India's social protection architecture, is extremely timely for a variety of reasons. Not least because we are in the wake of a very difficult 2020, witnessing the upending of so many lives, not just for health reasons, but also because of economic and social disruptions in all parts of the world, especially India. My own relationship with this topic did in fact begin at IRMA, the Institute of Rural Management, which some of you may know, was associated with the move for dairy cooperatives, which operate under the brand name of Amul. And so the issue of livelihoods is very close to me personally. And I think it's acquired a sense of urgency. So delighted that this week will be spent discussing the challenges of sustainable livelihoods. Before inviting our esteemed speakers, Sharon and Soumya, I'd like to briefly introduce you to Kriya University, which we consider one of the most exciting new experiments in higher education. Kriya builds on the legacy of IFMR in Chennai, which was not just a great management graduate program, but also the home to 5 world-class research centers, grounded action research, data-driven. And 2 of these research centers are in fact represented in this session through Soumya and Sharon. I just wanted to list these centers because these provide the architecture for our work on social protection. The first is JPAL South Asia, which is associated with the Poverty Action Lab at MIT in Boston. The second is EPOD, which also stands for Evidence for Policy Design, associated with Harvard University and faculty members at Yale. The third is LEAD, which stands for Leveraging Evidence for Action and Development, about which you will hear a lot more from my colleague Sharon. The fourth is IVAGE, which stands for the Initiative for What Works to Advance Women and Girls in the Economy, about which my colleague Soumya will discuss more and share our findings. And last but not the least, CDFI, which stands for the Center for Digital Financial Inclusion, which is doing incredible work with data analytics and a variety of state governments on linking services for the last mile. Now, Kriya has a unique focus on the kind of interdisciplinary research that has now become a staple of research everywhere. It's what we call the interwoven arts and sciences. And here we try to blend teaching and research with professional education through a multi-stakeholder set of collaborations with industrialists, civil society organizations, top universities, as well as, of course, the government, which remains in many ways the backbone for social protection services. Our research strengths lie in action-oriented research at Kriya through these centers, but also our fast-growing faculty. And the reason why this initiative took shape was because for the past few months, all of our research centers have chosen to come together to pool the resources and the research generated over the past decade to resolve the challenges that we anticipate in a post-COVID reality, which is upon us now, hopefully very soon. Since many Indians have fallen through the safety nets they traditionally relied on, Kriya is building on all this work to imagine what a future blueprint for social protection may look like. And we're doing this incrementally and perhaps more importantly for this session, collaboratively, which is why we're reaching out to all of you and sharing our work. So before inviting my first speaker colleague, I just wanted to quickly define for you what we mean by social protection and its relationship with livelihoods to frame our conversation, right? We have, in fact, put up a note, which you're welcome to download from the AVPN website that defines it in more detail, but I'll read it out anyway, that definition. Social protection is now widely accepted as encompassing a set of programs designed to assist individuals and households in maintaining basic consumption and living standards when confronted by a range of contingencies through their lifetime. The pandemic was a prime example of this. It is concerned with preventing, managing, and overcoming situations that adversely affect people's livelihoods and well-being. Social protection consists of policies and programs designed to reduce poverty and vulnerability by promoting efficient labor markets, diminishing people's exposure to vulnerabilities, and enhancing their capacity to manage economic and social risks, such as unemployment, exclusion, sickness, disability, and so on. All of these programs are created to generate sustainable livelihood opportunities, which of course is the subject of today's sessions. And so it is with this background that I'm delighted to introduce Soumya Kapoor Mehta, my colleague at Kriya, who heads IVAGE. Soumya has over 18 years in the development sector. She's held positions in the World Bank, at UNICEF, at the Center for Policy Research, amongst others. And her work on gender issues, and more specifically women's livelihoods, has been quite formidable. So over to you, Soumya, to introduce IVAGE and your wonderful work.
Thanks very much, Vivek. IVAGE really stands for the Initiative for What Works to Advance Women and Girls in the Economy. We were a gender research and advocacy center that was established 3 years ago under LEAD, which is Sharon's outfit, but mostly focusing on gender-related barriers. So the barriers that women face to entering into the workforce. We know that female labor force participation rates in India for an economy of its size are very low. So what are the barriers that women face to working? And moreover, if they enter into the workforce, what is the quality of work that they're undertaking? Now, in this context, of course, access to government programs, particularly a minimum level of threshold, becomes particularly important for women because a lot of them are really, at the bare minimum survival threshold level. So there are 3 things that IVAGE really does, and which hopefully, as we talk along it, you'll get a sense of by some examples that I'm going to provide, which feed into, an understanding of what social protection means, particularly for women, but of course for the poorer people in India, and how that, of course, may feed into the larger social protection architecture that Kriya University is envisioning. Now, the 3 pillars that we work on is firstly, when you have, of course, disasters and pandemics like COVID, or even otherwise, what is the threshold level at which, the poor in India operate, and particularly female poor? That's the first pillar. So we generate evidence on that. The second is, if we know that this is the threshold at which they operate, what is it that governments can do in the policy space, particularly in introducing schemes or even designing their schemes in a manner that they will be able to reach this constituency? So, for example, if you're thinking of a labor support program like the NREGA, what are the gender elements that you can consider and design? Why does it become much more important in a post-pandemic world, and so on? And the third pillar that we work on is really working with organizations which are providing these schemes on the ground, so the barefoot sort of provision, be it through government, networks. For example, we work intensively with the National Rural Livelihoods Mission and their self-help groups of women, or through organizations like SEVA, which are providing, social protection on the ground. So the first graph is really speaking to the first pillar, which is generating evidence on how poor people live in India. And this really is a study that we did with about more than 2,600 informal workers living in cities. And this was towards the unique part of the study is this was towards the end of the pandemic, so as recent as November and December. And what you would find is that on average, and the constituencies that we surveyed were construction workers, domestic workers, and street vendors across 5 cities in India, north, south, east, west. And what we found was that before COVID, they were on average, they were earning about 10,000 or 12,000 rupees per month. During lockdown, it went to completely zero. But after lockdown around November and December, it hasn't really recovered to the levels that we saw, pre-COVID. So it's still in the range of about between 7,500 and 10,000, which is a significant decline for the earnings that were there pre-lockdown. So really, we are talking of a precariat class, which is, living on these sort of earnings. The next slide, please. So what we do is we are also working with governments, even state governments, to think through schemes which will be able to provide that minimum threshold for people or an option that they can earn more. One is, of course, the NREGA. And now there is a lot of talk about providing NREGA in urban areas. There have been articles that have been written by Georges and others, to think of an urban employment guarantee scheme, especially because urban employment rates are so high. But what we really wanted to stress upon to governments that you need to also consider gender elements while designing this, because female labor force participation in urban areas is very low, is about 7%. That was what's the estimate in November 2020. And this is a class which is half of the economy in urban areas, that if you weren't able to reach out, recovery won't happen that soon. And the moment you start thinking about gender elements in designs of schemes like the Urban Employment Guarantee Scheme, you have to think about creches, you have to think about ability of women to actually access work sites, which is closer to their homes, because they have to also take care of their houses. They're living in nuclear families in urban areas, unlike rural areas. And you also have to think of even innovative models like a gig work, where you can actually go to the work site and work almost like a gig platform, and then basically get wages in lieu of that. That's the first part of our work. Next slide, please. The next part of our work, as I said, is really working with networks that are working on the ground. And this picture is of a pilot that we are running in 4 areas with gender resource centers. We are piloting gender resource centers at the block and the panchayat level, and also training SHG leaders who then pass on the messages to the lower levels of SHG membership in the Carter base to really connect women to government programs. And the reason these SHG leaders as well as GRCs become important is, particularly in post-pandemic, women do not know where to go and access their government programs, the direct cash transfers that have been sent out by the government. So this is really, you can see in the picture, these are women who are lining up at the block office to understand what are the cash transfers that have come in and how to apply for it. And we are also training, a larger database of NRLM, including bank correspondent Sakhis, and how do you provide doorstep banking during times of pandemic? How do you provide digital trainings for preventive health information, particularly around COVID and now the vaccines? And we are seeing, of course, differences in state capacity, but the model of actually having something on the ground which women can easily access has worked wonders. And the last slide, please. As I said, the final thing that we do is also work with organizations which are known as providing, resources at times and relief at times of crisis, particularly the Self-Employed Women's Association. So SEWA actually came to us to say, can you do an evaluation in the way our Angivans, which are the community resource providers, helping women? And we found that a large number of women really rely on these Angivans to even register for schemes and benefits. So had it not been for these Angivans, they would not actually, even the awareness levels of what is being provided in terms of social protection would have been very poor. And in terms of the evaluation, what was interesting to SEWA, the finding that we came up with is that you need to involve women in more and more meetings. Just coming into one meeting does not suffice for them. They have to come in more regularly. And the more they come in, the more aware they become about their labor rights, about their entitlements, and about their specific benefits. And I think that to SEWA sounded, sounded interesting, but also something that they took up programmatically later, because the resistance that they get from the family members in actually getting these women, not just for one meeting, but at least 4 meetings in a month, was something that was, something that they knew was a problem, but they knew now that they had to work on it, because unless regular meetings occur, these women will not be able to come in and at least know about their awareness, about their rights and entitlements, and or how to go about it. So I'll stop there, Vivek.
Thank you, Soumya. It sets it up very nicely for my colleague Sharon, who, of course, over the years has also worked with IVAGE very closely from for many years, and so it's wonderful to introduce Sharon to everyone. Sharon Bhutto has also been working in international development for about 18 years or so, and for the last 7 years in the digital financial inclusion space. Her work in nurturing micro and small enterprises has been particularly impressive. And so for all these reasons, I invite her to introduce you to LEAD and also the work that's been going on there. Sharon? Sharon, we're having trouble hearing you. I think we're having some audio difficulties. So perhaps while Sharon is able to fix those difficulties, may I turn to you, Soumya, to just sort of wait for Sharon to join us.
Sure,
to say some more about the work that LEAD does, and of course the presentation, which is of course about the Hak Darshak model. Yeah.
Sure.
So while Sharon, I think, joins us, if you could kick us off. Thank you.
Sure. So I'll just start, and the moment, Sharon, please, if you hear us and you're able to speak, please jump in. This is really a very interesting initiative that is being led by LEAD. And also, IVAGE comes in because we were providing funding, from a gender perspective, funding which came from the Bill and Melinda Gates Foundation. And the idea was that how do you use digital solutions to empower women so they can access their rights and entitlements? The partner in case is Hak Darshak, which is, if you could go to the next slide, I can introduce how Hak Darshak works. So the Hak Darshak model, this is just a visual representation, is basically a tech app that you can download on a phone. And what the app does is that it allows a person who's the customer service provider, the CSP, to really browse through multiple government schemes which are fed into the app, which are pre-fed into the app. What it does from the point of view of the citizen is it gives you a unique user ID where every citizen can fill in their basic demographic information, number of family members, if they have the Aadhaar card or even the poverty, are they below BPL, etc. Do they have disability? And using that data and the scheme criteria in that particular area, it's able to then start telling the user that these are the schemes that you are entitled to. Next slide, please. So this just shows exactly the steps involved. That is, the customer service provider, who in this case is called Hak Darshika, will come, and we are piloting this particular model in Chhattisgarh, will come and tell a user that there are 500 government schemes in Chhattisgarh. If you give me some time, I can run you through these schemes. And then when the woman, who's also an SAG member in this case, is giving, gets knowledge about these schemes, and also feeds in certain critical, demographic variables like marital status, age, whether they have, do they have their own land, their occupation, do they have a disability, etc. Then automatically, the app will throw that, well, this woman is actually eligible for 21 schemes out of the 500. Here's the list. And then the Hak Darshika will say, I can actually help you apply for these schemes. If you give me the required documents, I can even upload them on the app right away. And that itself will be the application. So it really takes the application process to the doorstep of this poor woman. Next slide, please. The reason this becomes very important, this last mile delivery, is because oftentimes poor people, particularly poor women, do not even know what schemes or programs are available to them. And that is also because of a lot of fragmentation and lack of uniformity on the supply side. So, and there are different eligibility requirements, they keep changing. You don't really know the kind of office that you would need to go to apply for these schemes. And even the application process is very opaque. So you really don't know which forms and documents are required, what fees you need to pay. So oftentimes just the scheduled fee is something that is actually the bare minimum, but the process of applying or visiting the government offices and the transportation required or paying a commission to an agent really adds on to the burden of cost. Even after application, it's very difficult for the poor person to actually trace the status of the application. You don't know when and whether it will get converted, whether, the benefits that I would receive are what I know about, do they match my expectation? And assuming I have a grievance with a particular application, who do I go to? How does that issue get resolved? Next slide, please. So what this does is, in Chhattisgarh, what the model that we are using is that we are training SAG members to become Hak Darshikas, or these agents who can make door-to-door visits and can help citizens discover these schemes and then apply for them with a fee. So far, we started this application only towards the end of 2019. So far, just for the state of Chhattisgarh, we have received more than 100,000 applications, of which a small proportion are application for documents like PAN cards or an NREGA job card or a ration card. A large number of them are applications for government schemes, particularly and very interestingly so, mostly for health-related schemes or insurance schemes like the PM Suraksha Bima Yojana or the PM Jeevan Jyoti Bima Yojana, particularly now after the pandemic. Next slide, please. In total, so far, Hak Darshak has trained more than 3,000 women, of whom, several of them after the training have agreed or signed up to become agents. And many of them have also performed at least one recorded transaction since the beginning of the project. On an average, in a month, about 800 to 1,000 Hak Darshikas are active in actually recording these sort of transactions. And the reason, LEAD has been doing a lot of work on studying why Hak Darshikas drop out, because ultimately the interest in is to see whether this sort of final doorstep, CSP model. Is it effective? Is it sustainable? And the reason quite a few of them drop out is because sometimes they face challenges in entering the community. So there is low community buy-in. Sometimes the citizens are not, willing to pay a fee. Sometimes we also don't know, although Haq Darshak has tried to identify who to train as a CSP, as a Haq Darshika, sometimes we are not able to identify the right person. Maybe, her access to smartphone is, at the start of the training is there, but then it gets limited later on. There are also concerns about COVID. These women don't want to necessarily go into the field. This is something that we changed particularly. We saw particularly after COVID. There's also, a desire to even increase their own visibility and, respect in the community, which really makes them sign up for the model. But eventually, if they don't see that happening, they drop out. But at the same time, we find that there's an incredible value that the users associate with the platform simply because they are just able to apply right away rather than actually waiting to go and visit a government office. So the idea is to provide these digital solutions on a very sustained basis to the users. Next slide, please. And this is the final sort of slide. I think what comes out is that, it's a great model, but it needs to be supported, through a human face, which is the Haq Darshika in this case. And the Haq Darshikas, in turn, need to receive a lot of motivation and engagement. So Haq Darshak and the lead team have been trying to do this, through online trainings, of course, now in COVID, but several in-person interactions. There's also a need to build the capacity of people who can mobilize these agents. Ultimately, Haq Darshak can't go into areas to identify which SHG leader would be interested in becoming a Haq Darshika. So that also is a prerequisite. The other thing that we tried out during COVID, which was very interesting, was we saw a lot of Haq Darshikas drop out. And this was because they thought that during COVID, we will not be able to, necessarily make an income because who would be signing up for schemes? We will not be going to everybody's houses. Why would they let us in? So what we did was we ended up giving them a 3-month fixed stipend. And that served to be a huge incentive for them when they knew that there was some fixed income coming in. And the reason we decided to do that, because this was the time that the need was the most. We really wanted the platform out in the field so people could use it and sign up for it, particularly when, DBTs were being rolled out, etc. You needed that information to go and reach the user. So to incentivize the Haq Darshikas, we did this. But in retrospect, this sort of a remuneration model actually works much better, where you have at least some fixed component, but you have a variable component that Haq Darshikas end up earning to ensure the scalability and sustainability of the program. Ultimately, it requires a government buy-in model. At least the Chhattisgarh SRLM called Bihan is very receptive to it. In fact, is integrating it into its own model of SHG leaders in, scaling it up. In fact, after the Chhattisgarh experience through BMGF, we ended up investing in a larger sort of rollout of, a Haq Darshak platform, which was really around COVID entitlements and rights, to which, I think Sharon and her team can speak another day. But hopefully, Sharon, this gives you, hopefully I summed up the project well. Okay, thanks so much, Vivek. Over to you.
No, this was incredibly insightful, and I can't help thinking that that while the two presentations were very different in terms of the kinds of challenges they were addressing, they both appear to share a fascinating attribute that always serves as a starting point when we are talking about social protection, which is that large-scale interventions, and the numbers from the Haq Darshak model actually reveal this, invariably start with the government framing the overarching architecture, right? And then we find that innovative interventions like the Haq Darshak model, or even the work that IVAGE is doing, work with a variety of stakeholders, right? The civil society organizations come into the picture, a variety of, the Haq Darshak software was designed by a private entity, right? And I actually had a question about how it is that both the centers work on developing sustainable partnerships at an organizational level which eventually retain a focus on last mile delivery, right? Because that is really where all the action is. And I wanted to get your reaction on the issue of how partnerships are nurtured and sustained, especially so that these programs become durable and have a long shelf life. So perhaps Soumya, if you could respond while, in case Sharon is able to join us, but if not, then Soumya, yeah.
Oh, sure. So I think both at IVAGE and Livelihoods, our effort has always been, as you said, last mile delivery is very important. And I think the effort has been in identifying, be it a civil society or the government or the private sector in the case of Hak Darshak, what is it that can really help our solutions reach the last mile. Hak Darshak was very innovative. It came to us with a proposal to BMGF, and I think we basically wanted to innovate how mobile ownership, Chhattisgarh, I mean, the reason Chhattisgarh was chosen as a pilot state, it's an interesting story because when Raman Singh actually, fought his last elections, one of the campaign pillars was that he distributed smartphones to everybody in the village. All women actually got smartphones. So we thought that, well, the penetration is there. Can we start, dipping into it to test this model? And this model became much more important, particularly after COVID. And we had to pivot it. We had to do digital trainings for Hak Darshikas, but we remained invested in the model because I think we saw that there was merit in that partnership. In fact, as I said, we ended up scaling it to 7 states only on COVID-related schemes. I think with civil society, SAICF as an organization, I think all of us know about, we know the network that it has in many areas. And we partnered with them because, there was a lot of work that was being done in COVID in terms of providing relief. And I think they also, basically saw that we brought to the table some research and evidence on what was missing or the gaps that they needed to focus on. And I think NRLM is a big partnership for IVAGE. We work intensively with the Ministry of Rural Development. And I think there, what they saw, the MORD saw in them was that, in us was that, they needed a documentation partner as well as to test a proof of concept, like providing, a gender resource center, or even trainings to cadre bases, just like Hak Darshika, but in their case, their own cadre base, who could then spread the word about the GRCs, say that, here are the schemes that are available. So in a way, the GRC mimics the Hak Darshak, but it's a physical office compared to a digital, like doorstep, this thing. So we tried all sorts of models. The idea being that the partnerships would just get us to the women, be it through the government or civil society or a digital app.
That makes a lot of sense. And I think as Sharon is also mentioning, in the chat box that, you do need a wide variety of partners to make this work. I had one question, partly because of my role in a payments bank, right? I mean, there's a variety of payments initiatives rolling out in the country. In fact, that space is on fire right now. And one of the challenges that we struggle with at the Geo Payments Bank is to actually reach customers who will benefit from payment gateways. But as you pointed out earlier, right, customers who really need a certain level of literacy and support to get to that point. And this is where partnerships do become critical, very much for the private sector as well. In fact, it is my considered view that many people in the private sector do not yet display the appropriate level of sensitivity to this issue, especially when we're trying to enter untapped markets that are peri-urban or rural. And so, this phrase you might have heard in, at least in the private sector banking ecosystem, of business correspondents, right? These are the people who are supposed to go help you find customers and work with them. Well, I'm looking at Hak Darshikas and saying, these are the real rock stars in some ways, because that model fills the gap that BCs aren't able to do in a variety of banking landscapes. I mean, this could go on and on, because I think fintech, health tech, as paradigms are very much on fire for a variety of reasons. And I think many people who've gathered for the AVPN, I think would echo that sentiment. I have been told that we're almost out of time. Any parting comments, Soumya, on the subject of how to imagine a future social protection architecture? I invite you to say a few things and then we'll close the session. Thank you.
I think, no, the only thing is, Vivek, I know that you've also developed a brochure on just the architecture and what we are doing across the Kriya ecosystem. So I think that's a resource that's available to participants. And as I said, we are looking at collaborations, not just in fact with, implementing agencies, civil society, government or private sector, but even in terms of governments per se, like the Urban Employment Guarantee Scheme. We've got a lot of feedback from state governments who want to roll it out. Some state governments have already done so. We also did a gig report on how women actually associate with gig platforms. How do you mix and match it with an Urban Employment Guarantee Scheme? So there's a lot of interest coming from the governments, from think tanks as well. So I think the beauty of the Kriya architecture and the universe is that it pulls together all of us, all the research centers, and the constituencies that we want to address are diverse. So there's a note that Vivek, that you have drafted very kindly, which participants could refer to.
Absolutely. No, thank you very much, Soumya. I'm grateful for the reminder, and I'd invite everyone to check out that note, and we look forward to carrying on the conversation offline. Sharon, look forward to hearing from you at a different time, but at least we're glad we can see you. But thank you very much. Thank you, Kevin. Thank you, ABPN.
Thanks, Vivek, and thanks, Soumya and Sharon, for joining us on this session. Sharon, we're sorry we can't hear you for today. Sounds like you've got really aggressive firewall rules at your campus. But, thanks for chiming in with feedback in the chat window. We've now come to the end of this session on rebuilding on this session, and it's made possible with the kind support of festival partners, Bill and Melinda Gates Foundation, Sesame Workshop India, the Rockefeller Foundation, COVID Action Lab, VNV Advisory Services, British Asian Trust, WPP India CSR Foundation, Catalyst Management Services, and Satva. Do share your highlights of this session on social media, and remember to tag us using the hashtag ABPN South Asia 2021 and hashtag social impact. Up next, the session on Bridging the Gap, Youth Aspirations and Market Opportunities will be starting in a few seconds, and you can access that from the agenda link in the platform. Thank you, and please enjoy the rest of this festival. Bye.
Thank you. Bye.